Well, hello everyone. My name is Tim Mikilashvili, CEO of Amadev Pharma and a host of the 4th Annual Medical Innovation Olympics. I'm here from the Fast Companies Innovation Festival, joining you with a different background, more dynamic background today than usual, my home office. And this session here today is designed to familiarize our audience in healthcare, innovators, scientists, with this event, with the rules, with the format. Those of you who may be just hearing it for the first time, or those of you who may be hesitating and thinking about whether or not to join as an attendee or competitor. And today I'm joined by our board members, expert judges, and moderators as well, who are bringing some creative learning opportunities for all of you. Okay, so we're working very hard to put together a strong program to accelerate access, quality, and continuity of healthcare. And I'd like for our guests to introduce themselves and maybe also tell the viewers why they should join. Maybe that first question immediately. So, Melissa, I'd like to go to you first.
Sure. I'm Melissa Norcross. I am the VP of Strategy at Highland Software, and I believe this is an incredible event because this is the moment in which innovation matters a great deal. There is all kinds of technology, all kinds of challenges out there that need to be addressed, and you can't afford to wait or pause. So this is a great opportunity to lean in instead of waiting for it to happen to you. So I'm really excited to be part of this and to help encourage innovation in ways that it may not be happening already. So I look forward to working with all of you.
Yeah, absolutely. Yeah, the panel that you moderated last year was certainly one of the highlights. Where Chris Piedmont was one of our speakers as well. So Chris, maybe you'd like to go next.
Yeah, happy to. So hi everybody, I'm Chris Piedmont. I'm the managing director of Neoterra Capital. We invest in startups at a very, very early stage, many of them in the medical, pharmaceutical, and other areas of biotechnology. So we're very excited to be here and part of this as well. There are many reasons companies should participate in this event. It is an opportunity to improve your pitch, how you present your company to meet others in similar spaces that can help you through introductions, through possibly assisting your team in a number of ways. Obviously, we here at Neotech are interested in companies that we can invest in, as well as those we can help through introductions and other means to advance what they're doing. So we're really looking forward this year to seeing the competitors, hearing their presentations, helping them refine them, and seeing who emerges as our Olympic champions.
Yeah. Thank you, Chris. This is the second year you're participating, right? And helping us plan the event. John,
yes,
you were a competitor last year, and this year now you're on the board.
Last year.
Yes.
Yeah, and I've been in innovation, I suppose, for about 42 years, because I set up a tech business 42 years ago. And obviously, in the period of time, I've also been a member of the UK Parliament, and I'm a musician in a jazz band and various other things. But more recently, I've got involved in biotech, and we're perhaps in an era where things are changing more rapidly than they have been for some time. And if people wish to surf the wave of innovation, now is a good time to do so. And obviously, if you need to surf the wave of innovation, you need to do it somewhere. And this virtually is a good place to do it, because it is an opportunity to put forward ideas that can then be developed in an environment where you're not going to lose out. It's all positives of participating.
Absolutely. Melissa, so I'm often referring to our competition as a festival of ideas as well. And so I find myself right now in a community of a lot of innovative scientists in healthcare at the Fast Company Innovation Festival, with Novo Nordisk, Pfizer, Eli Lilly being present here, as well as Highland. Highland Software is actually one of the sponsors of this event.
Absolutely.
And what I want to make one comment on what some of you have just already mentioned about being able to take an early peek at some of our competitors that we have and just making decisions earlier, and how important that is, because I've certainly made a lot of mistakes not acting early enough on very promising types of, let's say, opportunities in business as well. And I was reminded of that yesterday at a private evening reception here, speaking to Fast Company's, one of Fast Company's organizers of this event. And so there will be Wall Street executives and Fast Company organizers who are excited about our event and who are going to be joining here. And they have experience in healthcare as well as other industries. What we're doing here is essentially we're creating an event in which multiple different leaders can interact in areas that don't often intersect, and we want them to be more confident in really having that visibility to these new ideas, concepts, and products. And also the other part of this is moments. Right? Yesterday there was a speaker here at the Innovation Festival who's also one of the organizers, Ryan Simonetti from Convene Hospitality Group, and he talked about how everyone is now interested in experiential events, not just right in attending events where they can just share their experiences. Because when you think about it, our life is stitched with moments, some of those most memorable moments. And so what is that experience for our competitors here that we've created from your perspectives? Why should they attend?
I'll just kick us off. I think one of the things that we know more than anything else is that innovation happens when ideas that don't normally bump into each other, right? It's from places you wouldn't expect. We have loads of research and decades of experience that tell us that innovation goes up by orders of magnitude when you get new things bumping into each other that don't typically do that, whether you combine different schools of thought, different industries, different ways of approaching things. And this is a great environment for doing this, because you not only get the ability to mature your own ideas, but you bump into some of the best thinkers in other areas, in other areas that you don't normally interact with. And you're not just bumping into average people, you're bumping into people that are as passionate about leveraging new technology, leveraging new opportunities, and doing something unique with it. The people who are thinking about this and who are thinking about how to change the world with it, those are the people that you get to interact with, and those are the ideas that you bounce into. And so, often when you come to an event or you participate in something, you kind of know what you're going to get out of it. But I would say one of the values of this is that you get out exactly what you think you're going to get out of it in terms of innovation, but you get this whole layer of stuff on top of that, which gives you ideas and concepts that you can then use that you never imagined you would get. And that's where I think the power of this is. that you don't often get in these experiences.
Yep. Yeah, thank you. You've worked across different industries, finance,
Yeah.
pharma, industries
Yep.
as an executive and chief strategy. So that's very great. That's very important to hear from you. Chris, John, anything to add there?
Yeah,
Well,
I mean,
go
ahead, John. Yeah.
All right, well, I'll go then. All right. If you're going to surf the wave of innovation, you have to start at the top. And the Olympics are at the top. Start here.
Start at the top. Okay, I like that.
Yeah, and to echo more of what Melissa had to say, the word she didn't use was perspective. And I think that's a lot of what she's implying here is that you have a tendency when you're working alone or even working in small groups to not have a broad and differentiated perspective on what you're doing. Interacting with the community that we have, the people that have expertise in technologies, marketing, finance, operations, can help identify, potential weaknesses or areas of improvement in your plans that you may not be aware need addressing until you interact with someone. The other thing I really, really like and appreciate about the way you've put this together, Tim, is the ability to interact with people early and often throughout the process that we go through. Many of the pitches and events I go to are quick, one day. You got 5 minutes to say what you got to say and move on. And the challenge that presents for me trying to evaluate a venture is I really don't get a good picture. One of the nice things about working with the Olympics here is the ability to interact with these people often over a period of time, not only to get a better understanding of what they're doing and what their objectives are, but where they do have weaknesses that we can help address and help them work on prior to the actual competition so that they'll perform better. It really is a great event for anyone who's building a venture, especially if you're doing it for the first time, to get perspective and to get some help and to allow you to put together the best possible presentation by the time we get into the actual competition in October.
Yeah.
I love that. And I think the most common thing you hear at the end of it is, I never thought about that. I didn't think about it that way. And people land in places that they never would have been able to achieve without this experience and opportunity.
Oh, yeah. Yeah. And, I like both of the points that you made, which is that, look, you're going to get the value from this that you really, based on the energy that you take, you put into it. Okay, so for the competitors, it's very important. Also, listening to what Chris said, right, about training. This is an important opportunity for you to really come out after this event with higher probability of that partnership, that investment, that new client, right? Okay, so we have collected the experience from our executives of decades of in the industry and out and beyond, right? That can help you with that perspective as well, right? So if you're an investor, right, if you're a competitor, you need to set aside time, okay, in order to focus in this very distracted, chaotic world, like Chris mentioned, right? So that the investments that you make are smarter, also because you now have a more in-depth, view of latest innovations, right? And it's quite intense, like John said. I think to summarize what you said, right? We are actually fueling competition because you need a sense of a certain level of stress, right, and intensity for all of us humans to prepare more, right? Failing to prepare is preparing to fail, right? Like Ben Franklin said. So and you're going to get a chance to be inspired by Olympians. We have 2 Olympians again this year, as tradition has it for this event. Okay, so now that I'm kind of alluding to the format a little bit, I want to go through the rules, format, and I want to invite those of you who are watching this to share your comments, ask questions from us. We have less than 3 weeks to go until the opening ceremony. All right, so I know a lot of the leaders that are watching this, they have many questions. So take advantage of this opportunity. I'll also post the registration link as well. Okay. So let's go through a little bit of the format, what you can expect. All right. The theme this year is layer the science, leap with defiance. Okay. We are learning about that in pharma, in healthcare, as we're adding technology, okay, which is now being highlighted. And it's not just the support, but often the driving factor to cutting time for drug development and so forth and so on, and many different use cases. And we have to have a leap of faith for the future, but there has to be balance for that with that, right? Because in healthcare, the decisions that we make are ultimately guide or translate into a difference between life and death, right? So we thank Woven Health Collective for being our sponsor this year, New York Bio as well as Bullpen and My Medical Affairs. There are two categories, products or concepts, based on their stage. If you have a product that's now ready to be implemented, of course, that's going to be the category. There's 6 innovation tracks. Most of the submissions we have gotten so far are in drugs, devices, diagnostics, and med tech. Okay, a lot of you courageous innovators out there, you've already had the advantage of presenting for 5 minutes to our expert judges and receiving live voting. Okay, and you're going to be presenting in that order based on the votes that you've received. We're still opening this opportunity for you to compete in any of these 6 innovation tracks. The only difference will be that you may not have that Olympic trials kind of experience of training. Okay, so you're going to have to come in and be ready for 10-minute presentations in week 1 and then one in week 2 of the competition. Okay, so who should compete? We really want to open this up. This is not just a pitch competition for startups only. Yes, we have many startups, but if you're a student, you're a scientist working in the hospital care, healthcare system, or a consultant, advertising, medical communications, we want to celebrate your ideas because we're going to take them to the next level. Okay, you get to keep 100% intellectual property. You sign that as a waiver when you register. Okay. Now, I mentioned the new theme, the new slogan. Excuse me. What doesn't change every year is our mission to advance access, continuity, and quality of care. Okay. And we're looking for some of the latest. This is a festival of latest innovations. All right. So if you have made any significant change to your concept or product since October of last year, you qualify for this event. Now, here are the voting criteria. I'm not going to go into them in detail, but take a look at them. We'll share the official rules document with you as well. The voting criteria are different for concepts versus for products. Okay. And here they are for the products, where we're now looking for traction, market research that you've done, and also performance up to this point. And also for you to be open and candid about areas of your strength as well as areas of improvements and how you plan to address them as well. To have a roadmap. Now, take a look at this list. This is a list of our expert judges, 3 of whom you see here. No, 2 of whom. I'm sorry. I apologize. I know, Melissa, you will be speaking, but not judging this year. However, we are adding to this list of expert judges. There are some that are actually watching this broadcast right now that will be joining as well. And so not all of them were able to attend the Olympic trials. However, they will be there for the important milestones, okay? The important week, round 1 voting, round 2, and the live stream semifinals and finals as well. This is the format of the event at a glance. Okay, so we'll kick off the event with a full day of learning, expert panels. I'll share the topics on October. That's going to happen on October 6th. Voting happens on October 10th, that Friday. Then we have a second round that starts the following week, where our competitors choose the date and time they want to present. They record it for 10 minutes. You can attend it on demand or live if you have the time. And you have a week to interact with the competitors as judges, provide them comments, and then vote on that Friday. After which, there's some eliminations, and we then move into the semifinals and finals on October 20th and 21st, which will be conducted through a live streams in which competitors will get a chance to hear each other's presentations, provide a challenge, a comment, or a question as well. They're going to learn about each other. We're also going to learn about how they react to competition, their character, how they respond to challenge, right, as well, in real time. Judges are going to vote initially after their presentations before the Q&A, and then all the votes are deleted, okay? They're eliminated, okay? And all the competitors in the semifinals and finals will then have 2 minutes to summarize their concept or product, after which they will receive the voting, and only the final votes will count. And we've seen over the last 3 years how there is a lot of change that takes place in terms of voting as well. Now, you don't have to qualify for the semifinals and finals to receive special awards and recognition. This becomes a marketing effort as well, marketing exposure for all of you. These are some of the awards that will recognize various attributes of your concepts and products. And you may also choose to attend or sponsor this event, where you get a chance to ultimately network with innovators, with again scientists in a different, memorable format. Okay. So here's the flow for the agenda. I'm going to go over it very quickly. I will introduce the theme, layer the science, leap with defiance, why we came up with that slogan. I'll invite some of our judges to, as well as some of the sponsors to make some opening comments. Then we'll go into our double Olympian and also healthcare consultant at HAS UK, Chris Cook, Alex Giorgetti, to inspire our audience, share also some lessons from an individual as well as a team sport. And we have a series of keynotes, okay, from leaders. Sandra Walker, talking about neuroscience-driven strategies. Han E. Lee from Johnson & Johnson, global head of bladder cancer. We will then have our introductions for competitors. There's no competition. They'll only introduce themselves. These are the images of our 12 competitors, okay, right now from all over the globe. They're representing their countries as well, US, Canada, Norway, Georgia, Ukraine as well. We have an exciting keynote as well from Amber Saltzman. This is a new addition to our agenda. She is redefining precision medicine, okay, to cure patients from Epic CRISPR biotechnologies. We will also get a chance to truly get to know each other through breakout rooms, okay? Find things that we share in common, okay, to make this a memorable moment, okay? And also make it easier for us to share feedback, and translate that feedback. Melissa, so we're excited about your panel at 1:00, where we'll talk about how to implement AI. Are health systems really ready, and what advances we've made? Chris will interview me talking about medical performance, new ways to use a human algorithm and to ensure continuous quality improvement. Longevity medicine. Okay, so we have a tremendous panel of experts from across the globe. Okay, we're going to talk about this topic, which we've covered for the last 2 years as well. All right, at 2:00, there will be a competition, prizes as well. Market access leaders, Emily Phillips, Alan Gray, talking about what counts most in payer decisions. As well as how we're able to ensure that we remain scientific experts while also integrating technology, and how to do that in the most efficient way as we layer this talent. reward both in a way that matters most for patients. Okay, so a very interesting panel there as well. And we'll summarize some of our key findings at the end. So that's the agenda that we have planned here for everyone. I want to bring up our speakers here today and our judges. And there is a quote that I came across today, Melissa, John, and John, you may have a comment on this from an expert from Italy in longevity medicine who said Niccolo Machiavelli was quoted to have said that it's easy to cure diseases early, but difficult to diagnose them. Okay, so and we're making a lot of advances in actually, maybe preventing Alzheimer's, right? And in terms of aging, which doesn't necessarily have to be defined as a disease for us to make tremendous advances and leaps in treatments for it, right? This is what it reminds us, that it's very difficult to diagnose, but if you're able to prevent it early, whether it's Alzheimer's, cancer, there's a lot of new data and new technologies that enable us to do that. And so I'm very excited about covering longevity as well as some of the other topics. But from the perspective of topics and those who may just want to attend and learn, what are some comments that you have in terms of how we have structured the agenda, how it looks right now?
It's an interesting agenda. I would make a point about Machiavelli. He wasn't too bad on his politics. I'm not sure his medicine was that good. But obviously the geroscience hypothesis is that there is an aging pathway, and if you intervene on the aging pathway, you prevent a lot of diseases, and you deal with the incurable diseases like kidney, chronic kidney disease and things like that, which you can't say that replacing the kidney is curing it. You cure the symptoms. You've got a different kidney. You're not actually fixing the kidney disease in the first instance. And the geroscience hypothesis, I think, is good. And the fact that you've got longevity science, which looks at the geroscience hypothesis, is important. But as I said, we're in an area, I think, probably of more rapid change now today. And AI is part of that. I don't think AI is as big as it is sometimes hyped to be, because I think it still needs human beings. I don't think you can just switch the computers on and we all go to sleep somewhere. But at the same time, things are changing quite rapidly, and I referred to it as surfing the wave of innovation. And I said, you've got to give it a go, and this is an opportunity to give it a go.
Yeah, absolutely.
I would say, this agenda, I think, clearly brings in all of the things that you were talking about in terms of what's going on with technology. I mean, we all know we're living and trying to figure out what to do with AI, but that isn't the only technology that's happening to us, that's popping up. And this notion of, technology that can help us identify things early, that can help us treat things. It's not, what we have today isn't a surplus of solutions. It's a surplus of technologies that we need to work to find the use cases that will allow us to do something extraordinary with it. So the more you can get access and an understanding of those different approaches and technology and other things, the better positioned you are to solve any problem. And this is definitely a place to think about those, and it will have dividends. There is a long tail of dividends, right? You'll get some immediate help on these things, but you will also plant seeds that will then develop further down the path that I think often we understate is that, yes, you get immediate benefits. Yes, you get to participate in these things. You get to hear these things now. But the real value is that in a month from now, when you see the next problem, your toolkit is much more well developed and well stocked. So you have the ability to then go in and solve those problems better as well. It makes you a better competitor, but it makes you a better collaborator as well.
Yeah. Yeah, thank you. Yeah, absolutely. And so without giving too much away to your panel, I know there's going to be a lot of heated discussion in your topic there, Melissa. So, yeah, Chris, what do you think of the agenda?
I think it's great. We have a combination of things that I think should provide a lot of interesting discussions, a lot of interesting topics. This is an exciting time to be in medicine, to be in therapeutics, to be in pharmacology. There in the longevity work that John is doing and others are doing as well is very, very exciting stuff. So I'm hoping we're going to get to touch on all of that during the the coming weeks here and have some discussions about it. We're very excited at Neoterra. The applications we've seen in AI to do modeling and artificial testing to identify compounds and interactions that would take months, if not years, of actual physical experimentation is very interesting to us. Even in areas in medicine outside of the physicals, psychology, for example, we're seeing great advances in psychological applications of AI as well. So, an exciting time to be doing this. The competitors we have are all coming with very interesting and very new and exciting things. I'm really looking forward to it.
Yeah, absolutely. Great. Well, so I'm certainly not an investor, but I was reminded, as I mentioned earlier, by those who are expert investors here about certain opportunities that I had missed, and I want to also recognize and remind the investors that may be thinking about joining this that we have a strong group of competitors already. And so this is an important opportunity from a practical perspective to invest earlier because they're going to be successful. A number of them, if not all of them, probably, right? But so it's going to be a much larger investment later on for a lot of these. So it's a very, also cost efficient type of an opportunity, an invitation for you to get an early peek. Okay. Now, and so speaking of the agenda, I did fail to share a few others speakers, and I want to share them before we wrap up. We have also more learning that will take place during the closing ceremony. Okay, Liz Delgado, Maya Bailman-Schramm from Germany, Rob Adamowski will provide us with a medical affairs perspective. Okay, as well as a surprise format of a workshop. Okay, an Olympic workshop, an innovation workshop that's promised to us by Rashad Massoud, who's on the board of this event. Head of Global Health of USA at IQVIA, and Suzanne Pavone as well. All right, before we close and announce and distribute the awards to our winners. Okay, so make sure to spread the word about this event. Join. This is an experience that you will not forget. Thank you for watching this, and we hope to see you soon. Thank you. Thank you very much. Yeah. Anything else? Any final words?
I think that's it. Now's the time to go. Really, if you're into innovation, join this, participate.
Yeah, looking forward to seeing everyone. Everybody should sign up, should participate. Even as a spectator, there's lots to be learned and lots of interesting things to experience during this event.
Absolutely.